the presentation on male infertility. Do antioxidants improve male infertility? I will say yes, but only in men with high oxidative stress, where there is a proven high oxidative stress, just like when you do a DNA fragmentation test and you find it's a very high DNA fragmentation test, there you find it is effective. No benefit in men with a normal semen analysis with a low DNA fragmentation index. So I repeat again, it has to be only when there's a high oxidative stress. As far as India is concerned, these tests are not very much available, or whatever they are available, they are not standardized, so they are not available for all the ART consultants. Should all infertile men take antioxidants, which are very, very expensive? Answer is no. Antioxidants should be prescribed selectively based on semen parameters and oxidative stress markers, and which at present with us is DFI, high DFI. When is DNA fragmentation testing is advised? I again make a request to each and everybody. I've been using it, this particular test, for almost a decade, and people like me say that where there is a sustained rise, high DNA fragmentation test is there, we find that the fertility outcome is invariably poor. It is done in unexplained infertility, recurrent pregnancy losses, poor embryo development, or after failed IVF and ICSI cycles. What is considered a high DNA fragmentation index? Anything which is more than 25 to 30% is considered high and may impair fertility potential. We find in young, when you advise them the diet and the lifestyle, and you ask them, request them to have a frequent ejaculation, you find things definitely come down and in favor of the young male people who are with infertility. But sometimes I've seen that the people who are little elderly, who have a chronic problems like hypertension and diabetes, and in spite of the diabetes is well controlled and everything is well controlled, but you find sustained rise of DNA fragmentation. In those cases, pregnancy is very difficult by repeated IVF as well. Which antioxidants have evidence to improve DFI? I will list them together. Coenzyme Q10, L-carnitine, NAC, vitamin C, vitamin E, selenium, and zinc. Is coenzyme Q10 is effective? Yes. 200 to 300 milligram per day improves sperm motility and the DNA integrity. Both motility as well as DNA integrity. What about L-carnitine? 2 to 3 milligram per day can improve motility and reduce oxidative stress in selected men. These presentations will be available, both presentations will be available to each one of you. What about NAC? Is it useful? Yes. 600 to 1200 milligram per day is effective in reducing DNA fragmentation. The role of vitamin C, it definitely 1000 milligram per day, it protects sperm DNA from oxidative damage. Role of vitamin E, yes, it is there. Dose is 400 milligram IU per day, works synergistically with vitamin C to reduce oxidative stress. What is the role of selenium? 200 microgram per day supports sperm morphology and motility. Is zinc helpful? Yes. The role of zinc is coming up in a big way for adult usage, 15 to 30 milligram per day. It supports spermatogenesis as well as. How long should the supplements be continued? At least 3 to 6 months, because the sperm cycle is 72 days to mature and effects are seen gradually. And that is why when a patient comes to you initially and you tell them about the diet, the magic does not take place in 1 or 2 days. It takes minimum 2 months. Same is true with the lifestyle, which also does wonders, but over a period of 2 to 3 months. Risk in overusing antioxidants. Yes, Excessive antioxidants may cause reductive stress and hormonal imbalance. Should antioxidants be given to normospermic men? Big no. And the request is real big no. There is no benefit seen. It's a waste of money. A fixed combination of antioxidants recommended. Use evidence-based individual agents. Most combinations have unknown dosage and unproven efficacy. Now you have the dosage, and if you find a combination which fits in with these doses, one can use a combination as well. But you must see between the lines what all has been used and how much dosage it has been used. Do these supplements increase natural pregnancy rate? Only marginally. Only in men with an identified oxidative stress. That is, in present time, we only have DFI. Should men take antioxidants before IVF-ICSI? Only if they have a poor semen quality, high DFI, or repeated ART failures, and then also it should be taken for minimum 3 months before the ART cycles is started. And then also this antioxidants which you have been taking so far, and you find there is an improvement in semen parameters, it has to be continued and not stopped after 3 months. What is the role of in esthesioneurospasmia? Whenever you find that the motility is less, antioxidants may improve it. Are these supplements FDA approved? Mostly not. Mostly are sold as a dietary supplements and not rigorously regulated by FDA and big bodies. Is the antioxidant market driven or a science driven? And as for the science is concerned, mostly they are not science driven. It is driven by marketing with limited evidence for many popular products. Can antioxidants replace lifestyle changes? No. Lifestyle changes, dietary advice make a lot of difference. They cannot replace antioxidant. In fact, diet advice should be such that all antioxidant the person should be able to get from them. Smoking cessation, weight control, good sleep, and exercise are critical as far as lifestyle changes are concerned. Does varicocele affect DFI? Yes. Surgery, if you do it, may improve both DFI and the semen quality after that. Are antioxidants helpful in azoospermia? No. No role unless there is an oxidative etiology behind that, which is very, very rare. Do antioxidants improve ICSI outcomes? Modest benefit in selected patients with high DFI or poor morphology. Can antioxidants reduce miscarriage rates? Possibly by improving the sperm DNA integrity and embryo quality on the other side. Should men continue supplements during IVF cycles? Yes, if they have started, it has to be continued. If prescribed due to high DFI or poor semen quality, whether it's motility or counts. Otherwise, you should stop it. What dietary pattern supports the male infertility? It is plenty of fruits. 60 to 70% of your diet should be salads and fruits. You should mota anaj lena padega, or aapko nuts and seeds you have to take, which are rich in omega-3 fatty acids. So plenty of fruit and vegetables have to be included in your diet along with the lifestyle. Do stress and poor sleep affect sperm DNA? Big way. People who are interested and who sleep during the day and only get up in the night, this practice has to be changed. Chronic stress, insomnia, mental health issues increase oxidative stress. What is the final advice? Prescribe male antioxidants rationally. Avoid unnecessary use in men with the normal parameters. Evaluate DFI, lifestyle, and clinical history. Use evidence-based agents only and avoid blind combination and misleading marketing. I've heard Brigadier Sharma speaking to all the people who are, do not complicate your prescription. You should advise them diet, you should advise them lifestyle, and do not use fancy things in your prescription. So to summarize about the use of antioxidants wisely, prescribed selectively, only with clear indication like high DFI or poor semen quality. Avoid combinations, choose single ingredient, uh, only use studied antioxidants, which all elders prescribe. Lifestyle is first. Address smoking, alcohol. They should curtail their weight if they are obese, and also de-stress themselves. Inform patients that avoid false hope and unnecessary cost on these antioxidant medications. Now, what is the role of antioxidants in male infertility by Ashray? Ashray says that good practice recommendation for adds-on in reproductive medicine is that oxidative stress has been implicated in deterioration of sperm quality, count, sperm motility, morphology, and fertilization, and later embryo development, and suggested to be associated with risk of infertility, miscarriage, and recurrent implantation failure. Lifestyle factor, pollution, stress, allergies, and clinical varicoceles are considered to increase oxidative stress. Antioxidants are a group of organic nutrients that include vitamins, minerals, polyunsaturated fatty acids, which are suggested to reduce oxidative damage and balance the negative outcome related to oxidative stress. However, the methodology used in measurement of oxidative stress, particularly in sperm samples, the ideal combination of antioxidant therapy and the efficacy is very, very controversial. For male infertility, a Cochrane review reported that oral antioxidants given for 3 to 12 months may lead to increased live birth rate compared to placebo or no treatment. Very low quality evidence is there. When studies at high risk of bias were removed from the analysis, there was no evidence of increased live birth rate. I repeat again, when all those biases were taken out, there was no evidence of increased live birth. The Cochrane review revealed that the antioxidants may lead to an increase in GIT discomfort when compared to placebo or no treatment. So the recommendation by Ashray is in male infertility is antioxidant lacks substantial and reliable evidence demonstrating a significant enhanced live birth rate in male infertility. So the total sum is antioxidants therapy is not recommended in ART.
Beautifully summed up, ma'am. So beautifully.